Hello, this is Taher Sabobeh. I'm a second-year internal medicine resident, and I will explain in this voice recording our quality improvement project about implementing appropriate initiation of oxygen in medicine inpatient service at Truman Medical Center Hospital Health. First, almost all medical interventions have side effects. Correcting hypoxemia in acutely ill patients is vital. On the other hand, overuse of oxygen can cause harm through free radical formation. It can increase the risk of atelectasis, stroke, and cardiac events, and it can increase mortality and morbidity in such patients. With few exceptions, keeping patients' oxygen saturation merely above 92 is sufficient. And in COPD patients, the general consensus is to keep their goal saturation between 88 to 92%. So we wanted to know in our quality improvement project the current trend of oxygen use in inpatient medicine patients. Our aim was to increase the compliance with oxygen recommendations used among patients admitted to telemetry units at Truman Medical Center by 25% over 1 month. We excluded the patients who had oxygen at baseline, and our intervention included implementing a modified oxygen supplementation order specifying criteria for oxygen initiation into Cerner. And we did residents and nurses education about the appropriate initiation of oxygen therapy and effects on patient safety through conferences, posters, and presentations. Our primary outcome was to compare the percentage events of appropriate initiation of oxygen therapy between the intervention periods, and we looked at the length of stay as a secondary outcome. For the results, we included 299 patients in both groups. The compliance of using inpatient oxygen recommendation rate increased from 6.2% to 11.1% over 1 month of intervention, with p-value of 0.173. About a quarter of our patients had a COPD as listed diagnosis. The rate of change in the compliance among COPD patients was 16.6% pre-intervention and 15.3% post-intervention. The length of stay was similar in both groups, 4.9 days pre-intervention and 4.8 days post-intervention. So we conclude that there is a current lag in the compliance on inpatient oxygen recommendations, giving the low rate in both pre- and post-intervention groups. Possible inaccuracies in nurses' documentation of desaturation events might have affected our results. We definitely need more education to the nursing staff and residents to improve the rate of compliance and the importance of accurate documentations of desaturation events. We also plan to conduct a driver's assessment with stakeholders and more PDSA cycles to identify and address barriers to compliance and assess what interventions would shorten the length of stay. Thank you.